Hi, everyone. My name is Shibu Basheer, and I'll be the host for this webinar today. This is a series of webinars we do at Cabot Technologies Solutions, where we talk about everything that's technology in the healthcare domain. Today, my guest is Sonali More. She's a senior Salesforce consultant with Amdrodd. Amdrodd is our Salesforce partner who we work with closely on many healthcare Salesforce projects. Um, Sonali, welcome to the webinar today. Please tell us a little bit about yourself and we can get started.
Thank you, Shibu. Hello, everyone. Good morning, good evening, depending on your time zone. My name is Sonali More. I'm currently working as a Salesforce Health Cloud Consultant at Amdrodd Technologies, and I bring 7 years of experience in Salesforce ecosystem, specializing in delivering impactful solutions using Salesforce technologies. And today I'm really excited to be here and looking forward to share the insights with you all during this webinar. Thank you.
Yeah, Sonali. So, one of the things is most people know Salesforce as a CRM, but Health Cloud is almost like a different product, right? So, can you explain a little bit about the Salesforce Health Cloud and how it is being used in hospitals and healthcare?
Yeah, this is the question that comes up a lot. Basically, Health Cloud in Salesforce is like it's an extension of the core Salesforce system. You can consider it is a healthcare specific version of the CRM. It is built on the core Salesforce platform, but it adds some healthcare specific data models, the features and integrations to help the providers and the payers. Okay. Um, so instead of just tracking and customer data, it can track the patient, members or participants, and it will pull together the data from EHR systems, the claims, and even the social factors into a single view. So, and the main usage of this Health Cloud, Salesforce Health Cloud system is care coordination, patient management, or maybe an integration with EHRs. When I say care coordination, is like helping the care team to collaborate and manage the care plan across the providers. If we say the patient management, how it manages the patient is by automating the reminders or following up or maybe a personalizing outreach. And in terms of integration with EHRs is it doesn't replace the any other systems like Epic or Cerner. It complements them by focusing on experience and coordinations. So think of it like a EHR document care. Is EHR is a document care, but Salesforce Health Cloud will help to coordinate and personalize that care. So that's how we should look at the Salesforce Health Cloud system today.
Okay, so it kind of helps to enhance the patient experience as they
Exactly.
interact with in the healthcare network. Okay, so
Ex-
if I'm a patient in a hospital that uses Salesforce Health Cloud, how
Mhm.
would my experience be different than than a hospital that does not have a system like this?
Okay. Um, you will mainly feel the difference in how the connected and personal your care feels. Okay.
Mhm.
When you are going with the health cloud, your doctors and nurses can see your whole story, your whole medical story in one place. So you just don't have to repeat your story at every step, at every doctor
Okay.
or nurses. And the care plans that are there in the Salesforce Health Cloud are that comes together with the faster and it will feel more like a tailor specific to the patient. It is not just a template, I would say. So if you get a no timely reminders or maybe easy appointment scheduling or maybe a proactive check-ins before any small issues turn into a big one. So that kind
Mhm.
of a care has been taken care into this system. And without Salesforce Health Cloud, the care often feels like a fragmented. But with the Salesforce Health Cloud, the care feels like a coordinated, proactive, and centered on you as a person, as a patient. So, in a nutshell, I would say, I would put it like this: patient's journey in a one paragraph. That's where you can see the difference.
Okay, so as a patient, if I go to the hospital, I will have access to maybe a portal where I can log in and see my patient journey, from the start of when I went to the hospital, my details. I can do things like schedule follow-up appointments, and so on. Is that correct?
Yes, that is correct. We have something called community portal for the specific to the patients. So through
Mhm.
that community portal, you can view your personalized care plans, your doctor's visits, appointments, check-ins, those all the basic data you can see.
Okay, that's great. So, the topic of today's discussion is AI and Salesforce Health Cloud. So, why AI, and why is it important now for Salesforce in the healthcare space?
Okay, what I feel is AI feels an urgent in healthcare now because everything has come together in a healthcare industry today. What I mean by that is the data is ready in each sector in healthcare sector. Hospitals have spent their years in digitizing the records. Now AI, we can use that data for an AI. AI can actually use that data and surface insights. Okay, the first one is data. The second one I would like to highlight is clinicians nowadays are overwhelmed. So it will burn out and staffing shortages. So AI
Mhm.
can take on that routine work so that doctors can focus more on the human touch, or maybe they can focus more on patients interactions. Okay, that was the second point. The third point I would like to mention is patients expectation are also more nowadays. Now patients also feel that our care should be a personalized, like if a retail or a banking sectors are personalized, then healthcare should also have that feature. So AI will help to deliver that at scale. That's what I feel now. And that
Mhm.
simply to put that the data, the technology, or the urgency are all here, and AI is no longer the futuristic. It's a what healthcare needs right now. That's what I feel.
Yeah,
I
yeah.
hope that
And I
answers.
also, yeah, yeah, and that's great. And I also feel from talking to customers, there's always a lot of automation that can be done that will take away,
Mhm.
a lot of manual work from the administrative tasks, so they can actually spend more time with their patients. So it frees them up from doing, paperwork, and get them doing value add work with their patients. So that's great. So maybe you can touch a little bit about the human side of AI. There's often this concern that AI is going to replace healthcare jobs. But we are looking at AI to actually reshaping the roles of clinicians and support staff. So, what are your thoughts on the human side of in the healthcare delivery? How is it? How is that changing the roles of folks who use systems like Salesforce Health Cloud?
Yeah, that's actually a good point. And in fact, I have added that under my even the PPT section that I'm going to talk about.
Okay.
But the AI in healthcare is not about replacing the people. What I think is it's about giving them a time back when you go with the AI. Specifically for the clinicians, how it helps is it can take over your paperwork. Okay, and it surfaces the key insights so that they can focus on listening to the patients, or maybe diagnosis, and maybe caring for the patients, or spend some time on making the more complex decisions. So from the clinician perspective, it is that much useful when we go with the AI. But if we see from the staff, for support staff, how it will work, how it will beneficial is it can automate the routine tasks like scheduling or forms filling them to the spending more time on encouraging and educating patients, right? So support staff is also it is beneficial. And for patients perspective, what I think is it means more eye contact, more meaningful conversation with patients, and a strong that human connection that it can build. Okay, so AI doesn't replace the human side of care; it helps bring it back. That's what I take this as a AI is beneficial.
Okay, and I believe you have a couple of use cases that you're going to show us on how you're using AI in Salesforce Health Cloud. Yeah, are you ready to show that? You may feel free to maybe talk about those use cases.
Yeah, sure. Let me share my screen. Mm, Let me know if you can see my screen.
Yeah.
Okay.
Yeah, and just a quick thing for everyone who is attending today's webinar. Yeah, feel free to type in any questions as it comes along. We'll be reviewing the questions towards the end of the webinar, and we'll be responding to you. So feel free to use the chat on the right side of your screen to ask any questions. Yeah, go ahead, Sonali.
Yeah, perfect. So the bots that we have built in Amdrodd Technologies are the AI tools which will tackle the real challenges in healthcare. The first one is create care plan generator, which will help the clinicians to create these safe and personalized treatment plans. And the second one is episode predictor, which will help to identify the potential health risks before they become a big problem. So together, these tools will give the care teams the ability to plan with more confidence, stay ahead of issues, so that they can focus more on caring of the patient and not just reacting when something goes wrong. Um, so these are the two bots at a high level. Let's take a look at each one in a detail. The first one is care plan generator. What it does is very simple but powerful. It reads the patient's medical records, medication history, and then it suggests the personalized care plan that doctors can review, finalize, approve. Okay. Think of this it like a smart assistant sitting next to the doctor. Instead of spending hours on reviewing the files or typing an information into the forms, doctors can use this ready to use a draft plan, which is tailored for the patients. What it will do is this will save the time. It will ensure the consistency as well, and it will allow the clinicians to focus on patient care rather than paperwork. And from the technical perspective, it's a built on Salesforce Health Cloud along with Prompt Builder, and it becomes very flexible since we are using a prompt builder and it supports multilingual templates. Another key feature that I would like to highlight here is these care plans are visible directly on the patient portal. As we discussed earlier, can have their own portal, right? So this means patient don't just get a plan handed over them on a paper. They can see their plan in their own portal, that to be in a language in which they are comfortable, they can understand, or they can follow. So that's what a key feature about the AI generated care plan. As a result, doctors create these plans about maybe 60% faster, and patients can receive their guidance, which is more clear and accessible and personalized for them. So that's how, from technical perspective, it brings the features. The next one is the episode predictor. This is the second bot that we have built using Prompt Builder integrated with Salesforce Health Cloud. Okay. This bot will compare the patient's history data, all the historical data. It could be of medication history data or wearable data. And it reads that data from the similar patient groups with a similar pattern. And using that pattern, it actually predicts the future health events. What I mean by that is, for example, if a patient with a heart disease shows some early warning patterns in their data, so this episode predictor can flag that they are at higher risk of hospitalization. That means the care team members can act early. They can adjust the patient's medications. They can schedule the check-ins, or maybe they can provide an extra support before any complication happen. So just imagine the difference that it makes for both the patients and the care team. It can catch the problems before it can turn into the emergency. As I mentioned, technically, it is built with the prediction builder with Salesforce Health Cloud. It also works seamlessly with HL7 and EHR data. So the clinicians can get a complete patient view at a single place. I feel the outcome of this episode product predictor is exactly what nowadays modern healthcare is striving for, because early interventions and less hospital readmissions will anyways helps to the healthcare industries. In other words, this will make the healthcare more predictive, I would say, not only just and reactive. So instead of waiting for a problems to happen, we are empowering our care teams to prevent them. So that's the key feature or the beauty of this episode prediction.
You how does it work in terms of, are you pulling data from EMR, EHR systems? And what kind of data does it need to predict, you know, any episode?
Yeah, to make this prediction work accurately, the system can pull together the mix of data, clinical information, the history of care use, any EHR data. And we all know that the quantity of the data is important for an AI, but also here I would say specifically in healthcare industry, the quality of data is more important. So, and yes, it connects beyond the health cloud. So how it connects is through modern standards like FHIR, or maybe traditional HL7 messages, or maybe tools like MuleSoft. So it can integrate with EHRs, and in practice, I would say that EHR remains the source of the truth for clinical data, while Health Cloud layers on engagement, and AI, it will enhance AI to recommend next best actions. In simple way, the EHR will hold the records, but Health Cloud, Salesforce Health Cloud plus AI will help to predict and guide what should happen next at next level. So that's how data can be used for this prediction builder. Um, we already spoke about the AI and job, how everywhere it's a growing fear that AI will replace the human jobs. right? We already mentioned few things, but
Mhm.
recently we also saw that Salesforce had layoffs, right? Because nowadays, uh, obviously AI will replace the human jobs, but in many industries it is already seeing that shift is happening. uh, let's talk specific about the Salesforce AI Agentforce AI can now handle almost near about 50% of support tasks. It shows that how powerful that these AI agents can be in driving an efficiency. But it also means that the traditional roles are being redefined. And in healthcare too, I can no AI can take those repetitive jobs, those time-consuming jobs. For example, a drafting and care plan, or maybe analyzing the large volume of data. So, but I think the instead of replacing the job, the real value is in shifting the focus, as we already talked about this. Clinicians and care teams get more time for what truly matters. They can go to their patient, they can listen to their patient, they can provide an empathy towards them, which no AI can do, or maybe no traditional softwares can do. So instead of considering that AI will replace a job, just consider that AI will give us the care team members a more time. No, so the future of the healthcare job is not just an AI versus human. It's like AI with humans, where the automation can handle the routine, the same routine in the industry, but people can handle that human side of care. So that's the benefit here if we go with the AI in our healthcare industry. Uh,
Yeah,
the
I
key,
just also like to add that usually these kind of AI solutions, there's also this human in the middle kind of thing. So it's not like the AI is doing everything by itself. There's usually, at least in healthcare, there has to be a human oversight, who's the humans have to go over what the AI is recommending and doing, and they have to approve before it does it. So we in healthcare we're not 100% trusting that AI is going to do these things, but there's going to be humans. It's going to allow humans to do more creative things and more useful things while handling a lot of the automation or data processing kind of things to AI.
exactly.
And the humans can just go over, look at it, approve it before it becomes, like a care plan has to be looked over by a doctor and approved, right?
Yeah, definitely, definitely.
Um, cool. Is there
So
any demo or anything that you'd like to show in terms of the Salesforce?
yeah, yes, before that, I would just like to few things, highlight few things about care plan generator and episode
Okay.
predictor. Why should we go with this bot? Or maybe I would highlight as a why should we go with the AI? Because AI is not just a future concept; it's already transforming in healthcare how the care is being delivered. Okay, it streamlines the processes by improving the decision making, and it's actively shaping the patient's outcome. And AI can also helps the care team to work smarter. No? Doctors and nurses can plan faster. They can respond sooner to the patient needs. They it reduce the risk that might otherwise go unnoticed. So that's how AI will help. And finally, the tools like care plan generator or the episode predictor, these are the built solutions by considering the patients at the center. So they point to a future where care can be scalable. It will make it not only more efficient, but also more personalized and accessible, I would say. So I'll show you how these bots work in the system. I hope you can see my Salesforce screen right now.
Yes.
So let us take this as an example. This is just an instance data. I have one patient with some medical information, and there is a care plan section which is AI enabled. Now I'm asking this AI bot to generate the care plan specific to this patient with this patient's medication history. So behind the scene, if you see, it is analyzing our request, figuring out the next steps and working. So what it does is it passes this patient's information to the prompt builder, and prompt builder has some predefined templates which pass this patient information to the large language model and brings back the care plan which is in real. So that's how technically it works. Let's see the output of the large language model that it is fetching. So if you see the personalized care plan for CKD stage 3 at high risk, these are the parameters of the current patient, and it is suggesting me the medication and doses recommendation. Also, it is giving me some lifestyle and diet modifications, specialist referrals and follow-ups, home care instructions. The next schedule appointment is date is added over here, but what it is doing is it is suggesting me next to next appointment also. So as a care team member, I can get reviewed this plan with my medical expertise or a doctor, or I will explain it in more scalable way that doctors can use this as an AI bot, conversational AI. We can scale this prompt builder into an agent force agent and let this be open for the doctor saying, okay, doctor will open the patient's record and they'll like, hey, suggest me the care plan for this specific patient. Doctor they themselves can type that query and they can get this plan handed over. So by just reviewing the plan, they can either approve or reject. So that is just a scalability that I'm talking about.
Okay.
So
And this
for
suggested care plan, how does it, can it be attached to the patient record, or do you have
yes,
to copy paste it?
no, if you see this use, let us say I'm happy with this plan, I can simply use. So it got added here
Okay.
and just save this record. If I'm not happy, I can actually talk to this bot here, suggest me another specialist. So it reads the input, then it passes to the prompt builder, then again through the large LLM model, it again gives the output back. It's kind of a conversational window.
Mhm.
Then if I'm happy with this output, I can use this also. Okay. So
Okay.
for now, I'll just close this bot and I'll just save this record. So that's how my previous care plan was generated, and I'm using that. So as a care team member, I'll go to the doctor and or maybe send it for an approval to the doctor.
That's pretty cool.
Technical thing at the behind the scene is a prompt builder. This is the prompt builder, and input is the patient data that I'm adding. The model is a standard GPT-5 I'm using here, and these are basic prompts that I have added. As you see, the result was more kind of that, and here your prompt engineering will help to make it more
Mm.
accurate. Uh, that was care plan generator. When we talk about the episode prediction, so in Salesforce Data Cloud, we have prediction builders, prediction models. What those models do is it takes the some set of data, and we can train these models with those data sets. For example, I built this model saying predict the cardiac arrest. The data set that I have input for this model and training this model is having few data set with the patient with few medication history that got an cardiac arrest. And another data set I have in the same set is the patients with another medication history, but they don't have a cardiac arrest yet. So what I'm trying to predict here is what is the probability of the second set of patient to get an cardiac arrest if they have the parameters similar to the first set. So I'm training my predictive model. This accuracy of the prediction is high, and the the variables or the metrics that it uses is uh, totally configurable. I'm right now giving a diagnosis, risk level, and glucose level to predict the cardiac arrest. And if you go to the patient level, um, with this patient's history, the diagnosis as a hypertension, risk level as a high, and with this glucose level, it is predicting that cardiac arrest probability is 45.014%. Okay. Whereas if I open any other patient, let me open. Okay, you can see the Jade Halt patient. Okay, it is now predicting since the page got refreshed, or maybe we can enhance it like on a button click also, it will call that prediction builder and it will shows the probability. Mm, let's see how it runs. So cardiac arrest probability for this patient is 92.76. Why? Because my data set for the prediction builder had a lot of data which the patient with diabetes with the risk level as a critical, they got an cardiac arrest. So if I have a lot of data, massive amount of data which got trained with for that particular model, then the probability is high. So it is showing me that for this patient, yes, probability is high. And the key benefit is it no it gives the contribution also, like how much diagnosis is contributing for calculating this probability, risk level, and glucose level. So these are all the configuration or maybe enhancement or maybe in the uh, AI capability that we can leverage here.
Okay.
Yeah, so that's how this tool works in the Salesforce Health Cloud system.
All right. Yeah, thanks, Sonali. I see that there are some questions that has come in. Indu is asking if it is hard to add these AI tools to hospitals' existing system. So if they are already using Salesforce or Salesforce Health Cloud, how hard is it to use these AI tools and how do they find it?
Oh, if the healthcare system is already using the Salesforce Health Cloud, though, then the integration is very straightforward. So it is not very hard. It is inbuilt solutions. So I would say it is straightforward and easy to use, inbuilt with the data cloud. Once we buy the AI licenses, it is easy to just a plug-in kind of a thing.
Okay. And how does one find these? Are you in the marketplace or how do they try it out? Or
Yeah, we are working on that. We are trying to create the packages and we are trying to publish on a marketplace. So internally, we are
okay,
working on that.
okay. I have one more question. Victor is asking if this is Agent Force or a custom solution.
Uh, Agent, this is a custom solution, but we can embed this custom solution in the Agent Force agents. So I would say
Okay.
this is, yes, this is a custom solution, but it can be used into the Agent Force agent.
Okay. Okay. All right. I think that's all the time. I know we have 5 minutes. We had scheduled for 30 minutes, but we are 5 minutes into it. Do you have anything else to add to the leaders in healthcare, and also tell us a little bit about Amrod and how they can find you?
Okay, so just a key takeaway of the today's webinar, I would like to highlight for the the specialist in the healthcare industry or be the healthcare sector is if no the AI in health cloud is just not a replacement replacement of the doctors or the clinicians. It supports them. So take the AI in a health cloud as a supportive tool. It surfaces the right data at right time, and it cut down the paperwork, and it will give the care team members more space on what actually matters. That is a patient care. So that on that keynote, I would like to highlight few things about Amrod Technologies that we are basically in the specialized in service-based company. We provide the Salesforce configuration, customization, and integrations. We are we work in the module called CPQ Health Cloud. We are expertise in experience cloud as well, non-profit cloud, and we also do the sales performance management, which is SPM, which involves the incentive or compensation management also. You can find us on the Google. Just type Amdrodd Technologies and follow us on LinkedIn as well. Yeah, that's it as Amdrodd.
All right. Hey, Sonali, thank you very much for taking part in this webinar. This webinar will be available in a recorded YouTube video. Please do share it with your friends who might be interested in this topic. Yeah, thank you again. I'll see you in the next webinar.
Thank you so much for this
All
opportunity,
right.
Shibu. Thank you. Bye.
All right. Bye, Sonali.